Affordability. It's the big buzzword right now. Is the country moving in the right direction on it? President Trump is making a big push for it. Our panel is going to help us navigate this complex and vital topic. Please welcome Paul Mueller, a senior research fellow at the American Institute for Economic Research, and Michael Busler, an economist and public policy analyst, also a professor of finance at Stockton University. Thank you both for being here. Paul, let's start with you. Trump signed an order today to drop reciprocal tariffs on beef, coffee, tropical fruit, and other agricultural products across the board. The order said this is in part because of the, quote, current domestic demand for certain products and current domestic capacity to produce certain products. Your thoughts on this pivot and the impact tariffs have had on the economy so far?
Well, I think President Trump is recognizing that the tariffs have indeed raised costs for a lot of people, for a lot of products they consume every day. And what we see going on in the economy is we're seeing a divide where the economy is growing like crazy, gangbusters when it comes to energy and AI and big companies. The stock market is on a tear. But for most people who are going to Starbucks or going to the grocery store, they have not seen as much of the price declines that President Trump had promised because these tariffs have raised costs. It's a big tax increase. And I think President Trump is recognizing that he needs to pivot here to lower the grocery store costs for ordinary Americans. That's where a lot of, I think, the unrest in the economy and concern and pessimism is coming from.
Thanks, Paul. And Michael, please feel free to respond and share your thoughts on this as well.
So the overall effect of tariffs on the consumer price index has been virtually negligible. The inflation rate today is about the same as it was when President Trump came into office. Now, it is true some products have seen some increases in price and some of those food products, and Trump is working to get those costs down. Overall, the inflation rate is likely to fall. We didn't get a CPI number for October because the government was shut down. But the November number is likely to show that the consumer price index is falling, mostly because energy, which accounts for about 7% of the CPI directly and almost 30% indirectly, energy prices are falling. I don't know if you bought gasoline lately. When I was driving home today, I saw gasoline for $2.85 a gallon. Oil is down to about $60 a barrel. And President Trump says, based on his drill, baby, drill policy and a commitment from OPEC to increase output, he expects oil prices to be down under $55 a barrel by the end of the year and perhaps as low as $50. That'll translate into gasoline under $2.50 a gallon. And while there may be some inflationary pressures from some products because of the tariffs, it will be more than offset, the Trump administration feels, by declining energy prices. Trump feels that he's going to get the CPI down close to 2% by the end of this year. So the things that are a problem, he's going to try to work on specifically, but overall, the trend for the consumer price index is down.
Professor Busler, that's exactly right and very interesting. And I had a chance to look under the hood at that headline inflation number. And surprisingly, you don't really see those price increases where you would expect them. Imported goods and toys and clothes and stuff like that. A lot to talk about here. Paul, what's the big picture here? Has Trump made things more affordable within the 9 months he's been in office?
I think it's trending in the right direction. So I don't disagree with the point that was just made. So CPI is back under control. We're not seeing high levels of inflation that we saw under the Biden administration. However, the real question, that an economist would ask is, well, what's the alternative case, right? What would inflation have done without the tariffs? And again, I think even though there's this general trajectory that is going well and many of Trump's policies are pro-growth, tariffs have always been the odd man out in terms of slowing growth. And I think energy prices going down benefit different people and different sectors of the economy differently. So again, as I mentioned, the AI sector is going gangbusters, and that's good, and we should be pro that. But they're one of the biggest consumers of energy. Now, energy prices do go to consumers more broadly, but I think, again, that President Trump is recognizing that there are a few particular pain points that people are feeling. Again, coffee, it's not necessarily a big part of the ordinary person's budget, but it's something that a lot of people purchase on a pretty regular basis. And so they feel the 20, 30, 50% increase in prices there. So again, I think what President Trump is navigating is the pro-growth policies that I think are keeping the economy in a generally healthy place, but also recognizing that there's some very specific pain points for certain groups of people or very obvious products that they use frequently where the price increases have been more apparent.
Such a good point, Paul. And Americans need relief now. And maybe some of President Trump's policies and the Republicans have had an impact. Maybe it takes a little time for those things to really set in. Now, Michael, has President Trump's signature big, beautiful bill helped to ease the economic burden on families?
Well, it does take a little bit of time. And of course, tax rates remain low, and that helps everyone. A couple of things that we really have to look at. Healthcare costs are ridiculously high, and something has to be done about that. The government was shut down because one of the healthcare subsidies, which were passed in 2021 for 4 years, and it's set to expire at the end of this year, one of those extended. And that turns out to be hundreds of billions a year. I think it was 1.5 trillion over a 10-year period. While everybody, or the Democrats at least, are saying that, look, we have to stop this. If we don't subsidize this, healthcare costs are going to go up for tens of millions of people. And that's true. On the other hand, what about the 100 millions of people who pay taxes and have to cover this? They're already covering roughly 80% of the Obamacare premiums, and now they're looking to cover more, which is a result of what was passed in 2021. We need to fix the whole healthcare system. Obamacare promised us lower premiums, did not deliver. Increases in the quality, doesn't appear to deliver there. And you'll be able to maintain your doctor-patient relationship. That has deteriorated. So we need to look not just at a short stopgap here to worry about premiums going up this year. We need to take a look at the whole system and try to get this healthcare system down. Insurance companies have made exorbitant profits as a result of this Obamacare. President Trump wants to try to change that and get consumers to have more control over their money. And when people have control over their money, they watch it a little more closely. If you have insurance and the doctor prescribes a medication, you figure, I don't care what it costs, the insurance company's going to pay for it. But if there's more direct involvement from consumers, they're going to question whether, do I really need all these medications? Are there other substitutes that could be just as beneficial and perhaps at a lower price? So healthcare need to look at. And the other thing that we need to look at is housing costs, and they're starting to take a look at that too.
I follow exactly what you're saying, Michael. And we've had a data lapse, of course, due to the shutdown. But prior to that, you actually see that services were bumping up that headline inflation number, whereas the goods, not quite as much. And we know energy and food are volatile, so there's all these variables. But Paul, to you, will Trump's proposed alternative to Obamacare, dubbed TrumpCare, be less expensive?
It'd be hard not to be less expensive. As we was just pointing out, what the Democrats don't want to talk about is, they talk about premiums rising for people, and they just ignore, why is it so expensive, right? And it's because it's a system that's been heavily subsidized for over a decade now. And you see this in other industries like higher education, where you have significant government subsidies that boost demand, and it really just drives up prices at the end. And so healthcare is a system that has seen just dramatic growth in spending at the federal level, at the state level. There's a lack of incentives. There's a lack of transparency. The whole system is a mess. It's not easy to fix, but I'm guessing we can do better than we're doing now. We kind of need to do better than we're doing now, because our current system is unsustainable, it's wasteful, and it just piles on to the significant national debt problems that we're still dealing with.
And Michael, it seems like you would like to respond to Paul. And also, President Trump says that using TrumpCare, people can go out and negotiate their own insurance. I mean, how does that work? And will it bring down healthcare costs for the average American?
So we haven't seen the specifics of TrumpCare, so it's a little difficult to tell. Recall during Trump's first term, he actually had this problem fixed. He came up with a new system that would have reduced cost. The House of Representatives passed it. The Senate was very evenly split. John McCain was in the hospital. They brought him out of the hospital to vote on this. That would have been the 50th vote, rather, to take it over the top. and then he voted no. So we went right back to the drawing board and stayed with Obamacare. And since then, costs have continued to go up significantly, and people now are not able to afford the care that they really need. Look, the overall goal of the system is to get the highest quality health care at the most reasonable price and try to cover as much of the population as possible. Prior to Obamacare, about 90% of the population had health insurance. They were generally happy with it. They didn't like the cost of it, but they were generally happy with it. After Obamacare, only 91% of the population is covered by health insurance. So it didn't help that many people, and it ended up hurting a lot. We need to fix the whole system.
Fascinating conversation on this topic that literally affects everyone. Looks like we might just have a quick comment from you, Paul, and then we're going to wrap.
I would just add briefly that to control costs, we really need to focus on consumers and decentralized cost savings. We don't need the government to be setting premiums or prices. If they can restructure the system so that consumers can see the prices and make their decisions, that will discipline costs. That is how we're going to fix the system in the end.
Noted. Paul Mueller and Michael Busler, thank you both so much for joining us.
Thank you.
My pleasure.